Today, we're diving into a really powerful commentary from the Journal of Oral Pathology and Medicine. It makes a compelling case for something we see every day in our clinics, that oral health absolutely deserves a much, much bigger seat at the global health table.
So let's just start with one number to set the scene. 2.5 billion. That's how many people right now are walking around with untreated dental caries. It's a massive, staggering figure that really shines a light on a silent epidemic.
All right, so here's what we're going to cover in this explainer. First, we'll dig into the sheer scale of this crisis. Then, we'll explore that deep connection between oral and systemic health. We'll look at why policy keeps falling short, map out a path forward, and then, most importantly, we're going to bring it all home and talk about what this means for you in your daily practice. Okay, let's jump right into the problem. The article is crystal clear on this. Oral health is one of the most widespread and yet most consistently ignored global health issues we face. And the numbers are they're mind-boggling. I mean, look at this. It's not just the 2.5 billion with untreated caries. The source also points out that over 1 billion people are dealing with severe periodontitis. And on top of that, you have 377,000 new cases of oral cancer every single year, which is particularly devastating in places without easy access to early screening. You know, these aren't just numbers on a chart. This translates into a very real human cost. We're talking about preventable pain, people missing school, missing work, and even having their basic nutrition compromised. It affects every aspect of their well-being. But the problem actually goes even deeper. Because, as everyone in our field knows so well, the mouth does not exist in a vacuum. It's not separate from the rest of the body. In fact, the evidence, which the article really highlights, is just piling up. We see these clear links where poor oral health makes other serious conditions worse. It can complicate blood sugar control for diabetics, increase cardiovascular risk, and it's even been linked to things like adverse pregnancy outcomes. The connection is just undeniable. And this quote from the source just hits the nail on the head. It perfectly sums up the core issue. This artificial separation, it's not just outdated thinking, it's a systemic failure that is actively harming patients. So, you have to ask, right? If these connections are so obvious, why on earth does this separation still exist? Well, the commentary argues that the answer is rooted in long-standing policy and major structural barriers. We have this deep historic divide between dental and medical care, and that reality creates a system of fragmented care and really weak policy support. What we actually need is a totally integrated approach that treats the whole patient, not just parts of them. And this whole problem is made worse by some really serious structural issues. I mean, we're facing critical workforce shortages. In some parts of the world, there's less than one dentist for every 100,000 people. Think about that. And all of this is built on a foundation where oral health is just consistently left out of major public health policies. Okay, so how do we start to fix this? The great thing is, the commentary doesn't just point out all the problems. It actually lays out a clear, actionable path forward. The authors are calling for, well, nothing short of a paradigm shift. And it's all centered on 4 key actions. First, integrate oral health into primary care. Second, get essential services included in universal health coverage. Third, dismantle the financial barriers for patients. And fourth, we have to fundamentally update our policy frameworks. And hey, this isn't just some fantasy. The article points to real-world models that prove this can be done. Look at India. Their National Cancer Control Program now includes oral cancer screening as part of primary care. Or in Rwanda, where they're integrating dental services right into community-based health systems to improve access for everyone. It's already happening. So now we get to the really interesting part. How does this huge, global perspective actually translate into our clinics? How does it affect our day-to-day work with our patients? This really brings up a crucial question for every single one of us in the field. How does knowing all of this actually change the way we practice? We can directly use these insights to provide even better care. We can make our clinical decisions stronger by always thinking about the systemic health context. We can build better treatment plans by really considering a patient's comorbidities. And maybe the most important thing we can do is educate our patients on this critical mouth-body connection, empowering them to see their oral health as a key pillar of their overall health. At the end of the day, the big takeaway from this article is a powerful one. The work we do isn't some standalone specialty. It is a core part of primary healthcare. It's an integral piece of health, of equity, and even of human development itself. So that leaves us with one final thought to really chew on. Is oral health the missing piece of the primary care puzzle? And if it is, what role are each of us going to play in putting that essential piece back where it belongs?